And then our last objective here is to apply our knowledge of what we have just talked about as far as the neuromuscular junction to our understanding of some natural toxins that target the neuromuscular junction, as well as a disease that I'm going to talk about as well. And so there are 3 toxins that we will speak about. The first one is called Latroxin. And Latroxin is actually found in the venom of a black widow spider. This is why these spiders are so deadly and so dangerous. And this toxin actually results in stimulating excess acetylcholine release into the neuromuscular junction. Okay, so as we can see here, Latroxin, if you get bitten by a black widow spider, Latroxin is, sent circulating in your blood. And what it does to your motor neurons is it allows them to dump excess quantities. It kind of triggers inappropriate exocytosis, and more of that acetylcholine than needed is dumped into the junction. What do you think this will result in? What kind of symptoms might you see in this patient? If you were to predict some responses here.
Trouble thinking, trouble breathing.
Okay, yep, trouble breathing is an excellent one, yes. And the reason you might see trouble breathing is because of what we talked about before, so muscle spasm. So if we have more of that neurotransmitter continuously exciting the junction, these muscles don't have a time to relax. And they're going to eventually undergo what's called fatigue. We'll talk about fatigue in chapter 12. But when muscles are continuously contracting, this results in muscle spasm, muscle rigidity, and these spastic muscle contractions that eventually result in the muscle kind of just giving out under fatigue. And this can become fatal very quickly because of the involvement of our respiratory muscles. So again, the respiratory muscles, the diaphragm and so on, they are skeletal muscles. And so if they undergo this spasticity, this constant spastic or spasming or rigid contraction, they will eventually give out, and this patient will stop breathing, which can immediately, obviously, become fatal, okay? And so that is Latroxin, which can cause muscle spasticity and fatality. The second toxin we'll speak about is Crotoxin. And Crotoxin is actually found in the venom of a rattlesnake. So another animal here, another reptilian species here that can bite can bite you, and it can release its venom into your blood. And this has the opposite effect of Latroxin. This will actually block acetylcholine release. It's going to prevent exocytosis, prevent acetylcholine from being dumped into the junction. Now, what types of symptoms might you predict here? So what kind of symptoms might this patient present with after being bitten by a rattlesnake?
Would paralysis be one?
Excellent, thank you, yes. So paralysis would be one of the immediate symptoms, genital muscle weakness, genital muscle, tone loss and paralysis, because if we can't transmit acetylcholine, we can't send this signal. We can't, send the signal for muscles to contract. And so this patient would exhibit weakness and eventually paralysis, which can also become fatal if those skeletal muscles are influenced as well, okay? And then the last toxin we're going to look at is Curaware. And Curaware is actually a poison that is used by Native Americans and other groups that hunt. They find it in some plants that are existing in nature. They use it to apply it to the tips of their darts, and they can shoot animals. And the function of Curaware is that it binds to the nicotinic cholinergic receptor and it blocks it. It prevents acetylcholine from binding. So it competitively it competitively binds to this cholinergic receptor, it competes for acetylcholine, and it prevents acetylcholine from binding. So in this scenario, we would also see paralysis, right? We're not allowing for acetylcholine to cross the junction, to bind, and to result in that muscle contraction. So we will also see things like paralysis and weakness here. And that is actually the goal of these Native Americans and other groups that hunt that use Curaware. So they put this on their darts, shoot these animals, and it immediately paralyzes them so that they can collect. And then this happens again, you know, in other groups that hunt, they use this to their advantage, okay? The fourth thing that I want to touch on here is a disease called Myasthenia Gravis. And Myasthenia Gravis is actually an autoimmune disease, but it has a lot of relevance and application as we're speaking about these toxins and the neuromuscular junction. So an autoimmune disease, just to kind of explain what that is, it's a disease where the body starts to attack itself. And so it can start attacking different proteins. It can recognize them inappropriately as being foreign. And the immune system will start attacking these proteins or these components. And so in Myasthenia Gravis, we see that the autoimmune system starts attacking these nicotinic cholinergic receptors. And so it's going to mimic a Curaware type scenario, but essentially we're not going to have the synaptic transmission because we're blocking and destroying, right? So not just blocking and preventing acetylcholine from binding, but we're actually destroying, attacking and destroying these receptors inappropriately. And so these patients usually also present with weakness, paralysis, that starts usually with lower extremities, sometimes eyes, and then eventually can become fatal if it involves the respiratory muscles. And so going a step further here in terms of this clinical application, the medication that we give Myasthenia Gravis patients is acetylcholinesterase inhibitor, right? Can anyone think of the benefit that we would reap if we were to block this acetylcholinesterase? How would that improve our Myasthenia Gravis symptoms? Any ideas on that? Give another 30 seconds or so. All right, so if we're blocking acetylcholinesterase and we give these patients an ACEI, which is an acetylcholinesterase inhibitor, we prevent the degrading of acetylcholine, okay? And so we prevent that premature degrading of acetylcholine at the junction, and it allows more time for whatever receptors that we have existing to be able to interact with that acetylcholine and to bring about some neuromuscular transmission, some skeletal muscle contraction. So it's not advantageous in these patients to have the acetylcholine being degraded, right? Because we need as much of interaction as we can with the existing healthy receptors, with as much of that acetylcholine as is possible. And so when we give these patients these ACEIs, these inhibitors of acetylcholinesterase, they are immediately able to regain some of their muscle strength. And it's really cool. It's really interesting. I wish I pulled up a video, but if you go on YouTube, you can probably watch some of these videos where you can see in real time some of these patients that have, you know, droopy eyelids, slurring of their speech, droopy faces from that muscle loss of control, just general paralysis. And within minutes of giving them these acetylcholinesterase inhibitors, they automatically show improvement, right? The eyes start opening up, they start to control their mouth, and they can speak properly, they control their hands. And it's really amazing to see that within minutes of giving them this therapy, they can see the effects of having excess of this acetylcholine interact with their nicotinic receptors. All right, so really interesting scenario there to see. Okay, now as we wrap up here, coming to the end, I'm gonna encourage you to take a look at this study assignment, maybe over the weekend or anytime before our exam, but basically try to draw out and compare the flow of the efferent neurons and the synapse that's occurring for the neuromuscular junction, for the parasympathetic neuroaffective junction, and for the sympathetic neuroaffective junction. So all the way from going from the spinal cord, all the way out to that affected tissue, try to draw out all of the events. So the preganglionic neuron in the autonomic instance, the motor neuron in the autonomic instance, what area of the spinal cord they're arising from. You also want to put in the appropriate receptors on the preganglionic, postganglionic. You also want to think about the appropriate neurotransmitters here. And then you also want to think about the appropriate skeletal muscle versus smooth muscle versus cardiac muscle, et cetera, the relevant affected tissues, and try to draw all three of these routes of communication out as a way to really summarize and synthesize all that we've said in chapter 11, okay? And we'll probably do this when we look at a review at the end, but it's really important to try to do it now as a method of practice. Okay, so let's look at a few practice questions in the last couple minutes here, and then we will call it a day here. All right, so let's go ahead and take a look here. Okay, so a lot of response for C. Let's look at the question. So which is not true about adrenergic receptors? And just a bit of test taking guidance here. When you're looking at a practice question or even on your exam, it's really important to, especially when you get these not or these negative questions, try to think about the question in the direct. So try to think about which of these is true, right? You can kind of go through and tick those off and then think about applying that not, okay? I find that students often have a difficulty with these negative questions. They do add a layer of complexity. So that's one helpful way to do well at these questions is think about the question in the direct. So think about which of these is true and then apply that not, and that can be, you know, helpful there. So let's think about all of our statements and let's think about which of them is true to start. So we had an overall response for C. C says beta-2 receptors are generally inhibitory. That is true. And have a much greater affinity for epinephrine than norepinephrine. That is also true. So we know that C is not right, okay? C is not right because C is a true statement, right? Let's just make sure we're clear on this here. A, let's look at A. A says alpha-1 and alpha-2 receptors are generally excitatory, that is true, and have a greater affinity for norepinephrine than for epinephrine. That is also true. So A is also a correct statement, so A is not the correct answer. B says beta-1 and beta-3 receptors tend to be excitatory, that is true, and have equal affinity for norepinephrine and epinephrine. That is also true, right? They have an equal affinity and they're usually excitatory to the tissue. And so B is also a true statement and therefore not the correct answer. And so that takes us to D. So that's the last response here. Alpha-1 and alpha-2 receptors are generally inhibitory. All right, so we know that that is not true. They're not inhibitory to their tissue. They're actually excitatory and have a greater affinity for epinephrine than norepinephrine. That is also not true, right? Alpha receptors, both 1 and 2, prefer norepinephrine over epinephrine. And so both parts of D were wrong, and so D is an incorrect statement. All right, so it's kind of helpful to think about which statements are true so you can eliminate them and then apply that not, especially when you have these negative questions. So the correct answer here would have been D, which is not a true statement. Okay, let's look at another. Oops. Here I am completely losing track of the count there. Okay, so a lot of response for A. Let's see the question. In the parasympathetic nervous system, which neurotransmitters are released from the preganglionic and postganglionic neurons? So A says preganglionic release acetylcholine, postganglionic release epinephrine or norepinephrine. So that is not correct, right? Because we're looking at the parasympathetic system. So this is why I'm encouraging you to draw all three of these scenarios out so that you can clearly summarize and synthesize what neurons secrete what. So in the parasympathetic system, the postganglionic neurons do not release norepinephrine. In the parasympathetic system, both neurons release acetylcholine, okay? And so therefore, our answer here would have been C, because preganglionics secrete acetylcholine, postganglionics secrete acetylcholine. Now, we should have been able to eliminate D and B right away, right? So we should not have chosen D or B because no preganglionic neuron secretes epinephrine. All preganglionic neurons always release acetylcholine. And so right away, we should be able to eliminate B and D, and then it should have brought us down to A and C, of which we know that the postganglionic neurons specific to the parasympathetic side release acetylcholine, whereas if this question were to say sympathetic, A would have been the correct answer. Okay, so in no scenario, in no reality would B or D be right, but in the sympathetic division, A is right, in the parasympathetic, C is right. Okay, all right, and so the answer here would have been C. Okay.